Good day, I am Lesroy Williams. Thank you very much for joining us. Today I am back with Dr. Hazel Laws, who is the Chief Medical Officer for St. Kitts and Nevis, and Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the Joseph Nathaniel France General Hospital. We are continuing our discussion on the novel coronavirus 2019, what has been named by the World Health Organization COVID-19. The COVID-19 continues to cause major disruption and havoc in the world. And every day we turn on our televisions, we are made aware that the numbers keep rising in terms of people who are contracting this disease. Today, there are over 600,000 confirmed cases worldwide, over 30,000 deaths, and 202 countries affected. Of course, St. Kitts being a very small country, we are now affected with COVID-19. We have our first cases. 2 were reported first. Another 5 were reported yesterday. And today, there was another case reported, bringing the number of confirmed cases to 8 cases. Is there cause for concern? Yes. We have to be concerned and to do all that we can to stem this disease. Dr. Wilkinson, Dr. Laws, welcome again.
Thank you for having us, Mr. Williams.
Thank you, Mr. Williams.
Now, we now have our first cases, 8 to date. When did you find out, and were you surprised?
Well, Mr. Williams, thank you for your question. And when did we find out? Well, we would have found out about these cases within approximately 12 hours of the announcement being made to the general public. In other words, this is the process. The head of the lab at the Caribbean Public Health Agency, he usually sends an email to the office of the Chief Medical Officer informing of the positive case. And then there's a process. The individuals, the impacted individuals, would have to be notified first, and then an announcement being prepared for the general public. And so, so far, the public, have been informed within approximately 12 hours of our receiving the initial email.
As a matter of fact, what the CMO is basically saying is that there is never or has never been an attempt to conceal any information from the public. Once we are notified of the cases, the process is put in place in terms of notifying the person who was found to be positive, making sure that all the systems are in place before we go to the public. One cannot run to the mic within a minute of getting the positive results. And were we surprised? No, because if you look back at all of the other interviews we've done, whether it was here or in any other forum, we basically emphasized the fact that we had no confirmed cases, but it was only a matter of time. And we know that even in a first world country with stringent procedures at their borders, people can still smuggle in large weapons, drugs, etc. And this is a microscopic organism. It was only a matter of time before it crossed our borders, and it did. And so it is here now, and it's time for us to work together to control this.
Right. As I said in my last interview, the whole world is interconnected and interdependent. And so therefore, what affects one person miles away, 4,000, 8,000 miles away, can then affect us here in St. Kitts and Nevis. Now, in our last interview, both of you went over the preparedness plan that we have for COVID-19. And without repeating all of it, where are we now? Especially with our ports of entry, our community, our hospital as regards preparation?
Okay. In terms of ports of entry, we are all aware that our ports, our borders were closed last week. I think it was Wednesday night, March the 25th. And so that has made it easier in terms of our surveillance at our ports of entry. I think between then and now, we've had a number of ships or vessels trying to make calls and come in, and we have processed them accordingly. So actually, we've turned away a number of vessels. And so that's with respect to our ports of entry. In terms of our community-based health services and our public health response, we have increased our testing capacity. And Next Generation Lab, our privately owned laboratory, is up and running in terms of being able to conduct tests for COVID-19. Now, the public health team is taking an aggressive approach with respect to contact tracing. And so we have developed lists of the contacts of the affected individuals or infected individuals, and we have started our contact tracing. These individuals have been identified or in the process of being identified and sampled for their samples to be sent off for testing. So that's contact tracing. Our Health Emergency Operating Center, well, you're actually seated in our HEOC, or Health Emergency Operating Center 1. We have another such room at the conference room at the JNF General Hospital. And so it's within this room that the senior health officials sit, and we monitor the outbreak, and we make pertinent decisions in terms of our containing the infection. And so this is the HEOC, which is operational. Now, coming out of the HEOC, daily we are going to produce situation reports. All right, to date we've done 2. And so by the end of workday today, the country can expect the 3rd situation report. The helplines are up and running. We now have a cadre of individuals who have volunteered to man the health or the hotlines. The number to call is 311, and so these are functional.
Actually, before I go on to speak about the hospital preparedness, which you asked about also, I just want to speak about something that you mentioned in terms of the testing. Okay. Because in our last interview, we spoke about sending samples to CAFA and sending samples to our local lab also. And now that we are confident that the results from our local lab is highly reliable, we would be sending most of our specimens to our local lab, and this would be a much faster turnover. So instead of us having to wait 2 or 3 days for the results, we'll be getting them back within hours. And so if we are doing increased testing, we should have the results by the end of the day, and the public would get a quicker turnaround in terms of the information being released as to negative or positive cases.
Now, Dr. Laws, in terms of contract tracing, now that relies heavily on people volunteering information. Now, are you finding it difficult? Are people cooperating? Are people willing to say, well, these are the people that I have been in contact with, these are the places that I have gone, this is where I have mingled, and so on?
Very good question. And so far, so good, because the cases, they have been very willing in providing us the list of their contacts. And you and I are aware that we are humans, and we tend to forget sometimes where we may have been and with whom we would have come into contact. But you know what's very surprising? The contacts themselves are making contact with us and adding their names to the list. And so for us, that's very, very good. And so I think we've casted a very wide net in terms of picking up the contacts, the significant contacts of the positive cases that we have had so far.
Right. Now, what if a person refuses, Dr. Laws, to be tested? Because you may have 1 or 2 persons who might be a bit recalcitrant, rebellious, and would say, well, look, I don't want to be tested. Is there anything to enforce them to test?
Yes, we operate within the parameters of the regulations that have recently been updated by the Attorney General's chambers, and so we do have the powers to test. However, so far, and so good, we've only had one individual who refused testing but consented to remain in strict quarantine for the duration of the 14 days and was very cooperative with respect to that. And so I do not envisage a problem in this regard.
No, there have been questions raised in terms of confidentiality of the results of tests. Of course, when we had the first two cases, there, it was being disseminated on social media who those two persons were. And the confidentiality of results is extremely important.
Very important, and I'm glad you brought that to the fore, because as the Ministry of Health, when we reported the first two cases and the subsequent cases, we did not provide any means of identification of these individuals. Their names were not divulged in any way. And so we, the Ministry of Health, adhered to the whole concept of confidentiality. However, it's regrettable that other individuals would have leaked the identity of the first two cases, and so that's regrettable. And so let me reiterate, the Ministry of Health is very careful in terms of just providing just some basic information about those who have been impacted, some like demographic information, but we have not divulged any information that would identify those individuals, and that's very important to note.
Of course, people are stigmatized now and discriminated against because this is a new virus, just like when a few years ago we had the HIV virus and there was a lot of stigma, a lot of discrimination, and there had to be an education campaign.
Well, that's one of the reasons why
raising awareness.
That's why
we're here.
Yes, stigma and discrimination.
Yes. And so that's why we are here in terms of providing the public with the latest information about the virus and the outbreak. And in terms of stigma and discrimination, I think two other health professionals would have been interviewed by you a few days ago in terms of the psychological, considerations that that pertain to COVID-19, and so they would have been addressed at that time. I think it was through working for you.
Yes,
working for you. Yes.
They were dealing with the psychosocial dimensions of the mental health aspect.
So getting back to what we have done at the hospital so far, we have the private ward that has been emptied of regular patients, and now we have 15 single rooms that are there as isolation rooms for our first COVID patients. As yet, we don't have any patients admitted to the ward being managed as a COVID positive patient. You would have been aware of what happened over the weekend, where we had landing here 30 nurses and 4 specialists from Cuba, and we thank the Cuban people for volunteering their time and coming here to try and help us. 25 of these nurses and 3 doctors will be in St. Kitts, and 5 were dispatched to Nevis along with 1 doctor. We have stopped all elective surgeries, and meaning we are not doing any routine general surgery, orthopedic surgery, gynecological surgery, plastic surgery, or eye surgery, so that all the staff members at the hospital could have a laser eye focus on managing COVID-19 and fighting this vicious disease. We have doubled the capacity of the doctors in the emergency room because a number of the doctors who were working on other wards, because we have eliminated the elective procedures, then they are now placed in the emergency room. If you were to go to visit the emergency room right now, you will see that we have actually physically divided the emergency room into 2 sections. One where we would have persons with flu-like illnesses being managed, and the other with the regular emergencies. So there's a clear separation of the patients, and there will be a clear separation of the doctors and the staff who are managing these patients. We have increased our supplies of nebulizers, infrared thermometers, etc. And we know that a part of the management is ventilator care. We have on order 10 portable ventilators and 15 regular stationary ventilators. 5 of these ventilators should be on island. They were shipped already and they should be here within the next 2 or 3 days. We have increased our supplies of personal protective equipment. But I want to say to the general public, because sometimes persons ask if we have sufficient. Whether we have sufficient depends on your action. Because if you disobey the simple order to stay home, you can increase the spread of this virus. Just prior to this interview, I was in a virtual conference with the Chaimin Medical Center from Taiwan. This is a hospital that has over 1,700 beds and about 100 ICU beds. And we learned quite a lot from them. But there is one thing that was said that I want to share here right now. And the chief said that this is actually World War III. But it's a war between humans and a virus, not between humans and humans. And we all are on the battlefield, and we all have a part to play. And whether we win this war or not is if we decide to work collectively. And so it is not the time now for finger pointing. We all have a part to play, and we all need to make sure that we put our hands on deck and play that part.
It is always in times like these, the putting aside our own individual, our selfishness, and coming together for the common good, the public good, which is really a moral responsibility that we all have. No man is an island. And so therefore society, the concept of society is ever more real now, that we are a society and that we should look out for each other. Now, Dr. Wilkinson, the medical experts from Cuba that arrived on the weekend, 34 of them, they are trained in intensive care medicine. What does that mean? They're specialists.
Yes. Well, when someone gets acutely ill, they would have to be admitted to a special center, what we call the intensive care unit, where you would have, as the word suggests, intensive care. And this is a specialist who has extra training in respiratory therapy, knowing how to manage somebody on a ventilator, etc. And so these are persons who are highly trained in that field, and they'll be able to assist us in any persons who would require any extra care as it relates to ventilator support.
Mm-hmm. Now, of course, most people probably won't end up in a hospital because they probably will just be displaying mild symptoms. Who is more likely to end up in the hospital?
And I want to answer this question carefully, because sometimes when we speak about who is more likely, the persons who are less likely think that they are immune, okay? Because anybody can end up there, but the ones who are more likely to end up on respiratory care are the elderly and those with pre-existing conditions. But if you look across the world, we also have young persons who have ended up on ventilators, and we also have young persons who died from this disease. Therefore, no one is immune.
Mm-hmm. So the disease does not discriminate?
Because I think I saw some data coming out of New York City, whereby as many as 53% of the impacted persons were between the age of 18 and 59 years. In terms of and being hospitalized also. And so anybody, it can affect anybody.
And probably what happened in New York is that some of the young people were not taking this seriously. And they were out socializing, partying and so on. And then they now started to become infected. But the issue is, they're infected and their bodies might be stronger to resist and to recuperate. But then they go on to affect the older population.
That's where it comes into personal responsibility.
Now, social distancing, Dr. Laws, protocols. I mean, some people are having problems with that whole concept of social distancing. It doesn't really mean that we're emotionally distant. No. Those are two different things. We still have to, because we are human beings, we are connected, we are social beings, and so on. But I saw a video going around, and there's a lot of stuff going around in social media right now. You know, a lot of it is really untrue, some of it is amusing, and so on. But people at the beach, some people have been using this state of emergency, especially that time when we have freedom of movement between 5 a.m. and 7 p.m. to have their parties, their picnics, and so on the beach, and are not following the social distancing protocols.
Well, maybe it's time for us to talk about personal responsibility first, because that's the bottom of everything that is happening here.
Yes. So let's talk about it.
Yeah.
Yes. Okay, because it's important for, you know, sometimes we throw on these terms and people don't understand exactly the significance of what we're talking about. So I want to say what personal responsibility is. Personal responsibility means taking responsibility for your actions. In other words, it's being able to take care of one's well-being without expecting or blaming others for it. Personal responsibility is the willingness to both accept the importance of standards that society establishes for the individual's behavior and to make strenuous personal efforts to live by those standards.
I want to add, we all have a personal responsibility in terms of adhering to the recommendations that we have made in terms of protecting ourselves and our loved ones from this virus. And so very early on, the Ministry of Health, advertised those hand hygiene measures that you should be, you should adhere to. And it's very important for individuals to remember that it's their responsibility to keep their hands clean, keep your hands away from your face, and maintain significant distance from other individuals. Right now it's about 6 feet, because we know that the virus is spread through droplets. Infected individuals cough and sneeze, and then those droplets can impact you if you are nearby, and your risk of contracting the infection is increased. And so it's your responsibility now that the virus is here, is to really assume that everybody has the virus and maintain a significant distance as long as wide as 6 feet from the other individual to reduce your risk. Because the other individual with whom you are speaking may appear normal, they may not be coughing or sneezing, but they can be carrier. They can be a carrier of the virus. And so to protect yourself, you need to maintain that distance.
And just to interject here too, because sometimes when I speak to persons in the general public, they seem to think that the government, the Ministry of Health, has to do everything for them. So, for example, there are guidelines now as it relates to the number of persons who can go on a bus. And I heard the Prime Minister speak about 1 per seat and staggering, etc. But if you have an irresponsible bus driver who is determined to pack his bus, and that bus stops for you, you have a responsibility also to determine that, well, you are not going to go on that bus. And so this is where personal responsibility comes. And so we can't expect the security forces to be the only ones policing the buses and making sure that the buses are not overloaded. You have to take a personal responsibility in doing that. If you see the driver putting more persons than is required on the bus, you can speak to that driver also and tell that driver, you're doing the wrong thing, this bus is being overloaded. That's what personal responsibility
I want to also add, let's talk about isolation and quarantine. Persons we now have 8 persons who are confirmed with COVID-19. So now those 8 individuals, they have a personal responsibility to remain under strict isolation. And that means do not, and I repeat, do not interact with anybody else. And the reason for that is to reduce the risk of their spreading the virus to their loved ones. All right, so that they have an individual responsibility in that regard. Some individuals have broken, the conditions of their isolation. And so if somebody in the community is aware of this, that individual also have a personal responsibility to say, hey, what are you doing? You should be in isolation, and even make a report. And so that's where personal responsibility is of paramount importance as we try to fight this virus.
You know, we talk about personal responsibility, and it starts with you. It starts with me.
Yes.
But at the very same time, there has to be an understanding as well that we have collective responsibility.
Yes.
Yes.
And so therefore, the way that I handle or manage my personal responsibility affects the collective,
Yes.
affects the greater good, affects the public good. And that is where we need to go, to see how my personal responsibility and what I do can affect others.
Can I add?
And what others do can affect me.
Precisely.
And so therefore, we're in it together.
I want to add, we now have 8 cases. They are confirmed. They are diagnosed with COVID-19. Now, these individuals would have had interaction with their friends and loved ones or contacts. So now, the direct contacts to these individuals, they now are automatically in quarantine. And so they have a responsibility to remain in self-quarantine for at least 14 days. So this is another area of personal responsibility.
And not to go playing basketball.
No, not to go playing basketball, not to go out to work, and not interacting closely with other individuals, knowing that you were exposed to the virus.
Now, I wonder what this is doing to lovers. People who have intimate relations, because you're told no hugging and no kissing. Can the virus be transmitted through sexual intercourse?
I don't have any information on that, but the virus is transmitted through close contact. And so what...
Sexual intercourse is close contact.
I know that is close contact, but we don't have any scientific data on that as yet. But in terms of, you said lovers are persons living in the same house. Now, if, for example, with this curfew that we have, if you have a household that is not exposed in any way, there was no risk of travel, there was a history of travel, there was a history of contact with anyone who is suspected of having COVID-19, I don't think within that household they need to be staying 6 feet from each other, because it's inevitable that you have to interact with your children, your loved ones, etc. Okay? However, within that household, if there is someone who is at risk, that person needs to be isolated.
Okay. Right. Now, previously we said that the virus cannot be airborne, because that was a concern, and that it is basically transmitted through droplets, and that's why you had to wash your hands so that you don't put your hands in your eyes and your nose and your mouth and all of that. Can the virus be airborne?
And so, yes, the latest data or evidence that we are receiving, and this is out of Europe and North America, is that the virus can go airborne. It can remain suspended in air particles, and that's depending on the temperature and the humidity, for up to 3 hours. So that's a very important bit of information. And I also want to add that it's also telling us that it can remain, the virus can remain viable on copper for up to 4 hours. It can remain viable on cardboard for up to 24 hours. And it can remain viable on plastic and stainless steel up to 3 days. All right? And so that means if you are working, healthcare workers in particular, if you are working in the emergency room or on a COVID treatment ward, whereby you have persons coughing, sneezing, and you're, performing medical procedures on individuals, the virus can remain airborne for, an extended period of time. And so it's very important now for healthcare workers on the front line to wear the appropriate face mask and attire, particularly the N95 mask.
As a matter of fact, what this is telling us is that, well, you mentioned before that this is a new virus, and you can see that the information, as we learn, is changing on a regular basis. And we always have to be reading and trying to update and get abreast with the new guidelines. And so when we spoke to you last, this was not information that was out there, but now we know that it can be made airborne. And what it means then, if you go to a health facility and you see someone with a mask, etc., it's not any reason for any stigma and discrimination also. One is trying to protect themselves. And so if someone in the general public chooses to wear a mask to protect themselves also, we have no problem with that.
I see people wearing gloves as well. Are gloves recommended? Because suppose then that the virus gets on the glove and you're wearing the glove, then you're transmitting the virus. Is gloves or washing hands? Which is better?
Okay, we maintain that the best defense to this virus is hand hygiene, washing of hands, because then you're going to ensure that your hands are rid of the virus, and if perchance you touch your face, your risk of contracting it would be much reduced. Now, however, depending on your job, you may be interacting with the general public for a prolonged period of time. And so in order to reduce your personal risk, you can consider utilizing, though, appropriately gloves, because then it provides a barrier between yourself and the virus. But you have to use the gloves appropriately. You have to change them when necessary, so as not to transfer the virus from one individual to another, and even to yourself. And so you have a responsibility, again, personal responsibility, when you wear a pair of gloves. Yes?
Okay.
I just wanted to also add, based on this new bit of information with regards to the virus being able to remain suspended in air particles, some individuals may feel more comfortable wearing a simple surgical mask when they go outdoors and in the general public space. All right, and so that will now be acceptable, yeah, in terms of protecting yourself from contracting the virus. And I say a simple surgical mask, which can be purchased, or they are now locally produced surgical masks, and they are reusable. You can launder them and reuse, and so they are available here in St. Kitts.
Now, is this virus, this coronavirus, and you notice it's corona, in Spanish it means crown. It's a crown virus.
It is a shape, yes.
Yes, it is shapeless. But is it mutating? Which means, is it recreating itself? And what problems will this pose in terms of the development of a vaccine?
There has been evidence that it is mutating as yet, okay, and persons are still working on on the vaccine, and hopefully we should have one within a year or two. But for now, the things that we need to do to control it in the absence of a vaccine, the things are simpler.
And the things we have power over.
Yes.
Yeah.
Personal responsibility, social distancing, washing your hands, basic things.
And maintaining a distance, 6 feet between others.
A year seems to be a long time.
Yes, but we don't need to focus on that because we have other things. It's not that we are hopeless while we are waiting for a vaccine, and that's the most important thing. And so for those persons who you said who were on the beach, who were by the bars, etc., these are persons who can make a significant difference. Don't forget I told you what the gentleman said from Taiwan, which resonated with me. This is World War III, and it is humans against a virus, and what we do can affect everyone else's life. Okay, and so for those persons who think that it is okay for them to go and mingle on the beach, they might be taking that virus back home to their mother or their grandmother, who might not survive. And so we all have a responsibility.
It's biological warfare. Some people say it's that. Now, there's a lot of blame going around. I've heard people say, if we had closed our borders at least 2-3 weeks earlier, then we would not be in the situation we are now. What do you say to that?
I'll start off. And I always like to use an analogy so persons can understand clearly. If you gave me a house to build, there are always going to be timelines that you're working with. And so if I am pouring the concrete for the foundation and someone comes and starts to ask, where's the roof? And that to me would not be a pertinent question. If I'm building the cupboards in the kitchen and someone shows up with the fine china for me to put it in, I will have to tell them, oh, we are not ready for that as yet. And so we have been on top of this from the very beginning, and we've been putting things in place. And some of the actions would have been premature had we taken them a week or 2 or a month earlier. But you can see from the plan that everything is falling into place. I don't know if the CMO has any comments to make.
Yes, I would like to add that closing our borders, closing our schools, and the other social distancing measures are very important interventions in terms of containing an outbreak. And really and truly, they should be instituted when there is local transmission, meaning infection being spread from one individual to another without a travel history. And in terms of the Federation, we closed our borders last Wednesday. We closed our schools last Wednesday. And that coincided with the day when we announced our first 2 cases. So we are actually ahead in terms of doing so.
And actually, even before we closed the borders, we were still taking proactive steps
Precisely.
to
Screening.
identify persons
Yes.
who were coming from
Yes.
high-risk areas.
Yes.
So it's not that we suddenly closed our borders
Right.
last
Yeah.
week. We were taking steps way before to control the persons who were coming in to the
Right.
country.
So I think, those 2 interventions occurred in a timely manner. Yeah? Yeah.
Now, I've seen some people are using this COVID-19, this pandemic, to score political points. When I go on social media, I often see, oh, the Prime Minister had this information 5 days ago, and he didn't release it to the public. I know the Prime Minister relies on expert advice. Also, the Prime Minister is not a medical doctor. The Prime Minister is not testing people. He has to rely on, and the release of that information and so on is not dependent upon him. What do you say to that? Do you think that you are in the medical profession? You would have an idea in terms of how many case samples were sent off to CARFA, how many samples were sent to the local lab here. When the tests were done, how many came back positive or negative. What is your responsibility in terms of relaying that information to the public in a timely manner, an accurate manner?
That is speaking to our credibility, and I'll let Dr. Laws speak first, and then I'll speak after.
Okay, so Mr. Williams, I have been serving as the Chief Medical Officer for the Federation of St. Kitts and Nevis since September 15, 2016. What I can tell you is that my decisions, my recommendations, and the interventions made within the Ministry of Health are all data-driven, and they are all guided by the latest evidence and science. Under my leadership, we take an aggressive approach. We are taking an aggressive approach to contact tracing and containing this infection. We aim to keep the number of persons impacted by this virus to the lowest. In other words, we want to flatten the curve. We want to get through this outbreak at the fastest, and we want the country to return to normal at the soonest. So for me, I am serving the people of the Federation humbly, yet I'm giving my utmost, my best to this fight or this war that Cameron just referred to it as. I am apolitical and I am non-partisan in so doing. I am for the people. In other words, I'm for all of the people of St. Kitts and Nevis. And so I serve with honesty, and the recommendations that I give to the cabinet, I do so with utmost care.
Okay. And as it relates to me, I am currently the longest serving doctor with the Ministry of Health, having worked for over 23 years with the Ministry of Health. During that time, I've advised 5 different ministers of health. One who was my headmaster and who knew me since I was a child. One who was my high school teacher and who knew me since I was a child. Now, I've also worked under 2 different administrations giving advice. I take my job seriously. I take the welfare of our nation seriously. And any advice I give is objective, it is based on facts, and it should be able to stand the test of time. In other words, if I'm giving you an objective opinion, whether it's today, tomorrow, 5 years from now, 10 years from now, it should be able to stand the test of time based on the facts that were available to me. I am never partisan in my advice, and I don't have any personal agenda, and I'm not seeking any personal goals. My heart is with my people, and I do the best, and I try to serve to the best of my ability.
As a critical thinker, when I see these things, I ask myself, why would anyone in their right mind want to jeopardize public health? It just doesn't seem rational to me. And our people should really be critical thinkers and to ask, what really is the agenda of people who are putting these things on social media?
Well, you know, I look beyond that and I focus on the job that I have at hand. And sometimes I look at things that are being placed on social media as a guide, because it's important for you to hear the negative and the positive.
Yes.
Okay. And I use it in that way. But I try to stay laser focused on the job that I have at hand. And I'm happy that I have someone like Hazel, who I'm working with, somebody who I knew since in medical school.
Yes.
And we have a very good working relationship. And I believe that's important also. And so sometimes the public need to be aware of the fact, even of the hours that we put in, you know. I was calling Hazel to follow up on something yesterday afternoon at 4 o'clock, and she said, oh, I'm just eating lunch. Can you give me 5 minutes? At 4 o'clock on a Sunday. You remember?
Yes.
Now, a 14-day state of emergency, a lockdown or a shutdown or what people want to call a curfew, or some people call it a quarantine in some places. Is it necessary? What is the objective of it? I listened to a caller the other night to the Prime Minister, and the caller basically said it doesn't make any sense. From 7 p.m. to 5 a.m. in the morning, you're locked down at night. And from 5 a.m. to 7 p.m. at night, you're free to roam and to do whatever. It defeats the purpose. That is what the caller basically was saying, which is a misunderstanding of the state of emergency. So what is the objective of it? And why 14 days? Why not 3 weeks? Why not a month?
Okay, so let me start by answering why 14 days. Well, the incubation, the official incubation period for the virus, COVID-19. When I say incubation period, I mean the period between which an individual would have contracted or the virus, or the virus entering the body of the individual and the manifestation of symptoms is 14 days. And so the rationale behind 14 days is that within this time period, you are going to see the number of individuals who would develop, most of the individuals who would develop symptoms, they will manifest or show up within this period. And so the health system will have an idea as to the number of patients that are to be treated and the impact on the country.
Because
and so that's why 14 days.
And I want to add something here. 14 days in the first instance.
In the first, oh yes, yes.
Because we will reassess where we are after 14 days.
Yes.
Because if after 14 days we realize that the numbers are starting to spike, it means that to kill this virus, to decrease the spread, we would have to institute further measures to socially isolate persons.
Yes.
Okay?
Yes.
And this thing about the fact that the curfew is in the night and the day you're free to move around, it is not so. But what we're trying to do is to limit the gathering of persons. And we know most of the bars, etc., persons buy them at the night times. Okay? And so that can have a significant impact on decreasing the spread by making sure that persons don't gather in these social places in the evenings. But in the daytime, it's a time for you to go and restock your supplies. Go to the supermarket if you didn't have the means to stock up for an entire week or a month. Go to the doctor if you're sick. Go and purchase your medicines if you need to. It's not for you to be walking around as usual.
And I just wanted to underscore the rationale behind it. All right. And so during this period, we are reducing the risk of the virus spreading from one individual to another by creating or enforcing distance between individuals. And so this is one significant measure that we are utilizing to contain this highly contagious infection.
And we saw that it worked in China.
Yes.
Granted, the measure was considered draconian at the time, but by keeping persons in their homes.
I think I read that for the 6th day in Wuhan, in the Hubei province, they've not had any new infections, and that China is starting to return to normal. Of course, in those societies, they're communists and so on, and they take very draconian measures. And so on. We're more for democracy and so on, but yet we ask people to comply with the regulations.
We're actually appealing to their common sense
and social
responsibility.
And social responsibility.
Yes.
Right. Now, if someone contracts the coronavirus, they can be symptomatic and they can be asymptomatic. Now, my concern a lot is for those persons who are asymptomatic, who do not know that they have the virus, and who might be transmitting it to others unknowingly. That is the danger.
And so that's why I'm very happy that we are in this state of emergency, because the movement of such individuals are restricted. And so there is hope that those individuals would not be infecting many persons, if any at all. So that's one of the reasons why this period is so important.
Yeah, so we're basically saying then, in this 14-day period, if you have that virus and we ask you to stay in your house, and if you're one of those persons who are going to be asymptomatic and you would recover without any problems at all, you would not have the opportunity to infect anyone else. And so if everyone considers themselves as being positive, having the virus, and they stay in place, then we can control this. Of course, the essential workers have to go out and do what they have to do. We are on the front lines and we can't stay home, but you have a personal responsibility to stay home and make sure that you decrease the spread of this virus.
Isn't everyone who has a cough or a fever that they should get tested? Because I remember you saying, Dr. Laws, that we are still in the flu season.
Yes.
And one has to distinguish between if you just have the common flu or if you have the COVID-19. So how do you, if I have a fever now, or if I have a cough, should I go and get tested for corona?
Well,
If I have a headache, if I have a diarrhea, because
yes.
one might, think, because this is the climate in which we now live, that every little thing that affects you like that you do have the virus.
But I'll answer you, because once the virus becomes endemic and you start to have community spread, then it means that anyone who has a fever, who has a cough, they are suspect. And so it means then that you should be tested. And that's one of the reasons Dr. Laws will tell you about a new initiative that we're going to be starting, making it available to other persons to get tested.
Yes. In other words, we are trying to develop an appropriate sample collection site at the hospital where individuals can drive in. You can have your sample collected in a very convenient manner, and then you can exit the hospital. And so we are in the process of putting that in place, just to make it simpler and to make testing more accessible to everyone.
And there is no point in someone knowing that they're positive and not doing what is necessary.
Precisely.
Because if you know your status, it means that you have to isolate. Okay?
Yeah.
And if we also assume over this 14-day period that everyone you come in contact with is positive, then it's important for you to maintain your social distance. And so that's why the way we are going to fight this is not right now through a vaccine, which we don't have, but it's going to be through obeying the rules, social distancing, making sure that we decrease the spread.
Now, testing sites. Is the only testing site that of the hospital, or can I go to my private doctor, get tested and send it to the lab, but yet and if I come back positive or negative, it has to be reported to the health authorities?
Yes. So yes, you can go to your private practitioner. He or she will assess you, and if they think you have COVID-19, the appropriate sample will be taken off and sent to the laboratory. The Ministry of Health, my office is notified of all tests being done, and then when the result is ready, if it's positive, I am notified, the Office of the CMO, the National Epidemiologist, we are all notified, and the patient is also notified of his or her status. And so you can also be tested through the public health system, whereby a district medical officer can take the relevant sample, send it to the lab, and then you will be given your results.
Okay.
Yes.
I think we've said quite a mouthful. Is there any other advice that you would have to keep us safe, all of us safe?
Well, I just want to end by repeating the basics again in terms of public health hygiene recommendations: washing your hands, not touching your face, making sure you don't touch items that are commonly touched like doorknobs, or if you do, you make sure that you clean them. You scrub your hands for 30 seconds from the elbows down. If you're going to sneeze or cough, make sure that you practice the proper etiquette. And one of the things I want to say about that, persons like for you and I in our generation, we're accustomed to cough in our hands. Okay? When I see my grandson, every time he coughs into his elbow. And it's not every single time one coughs, you might remember how to do it the correct way, but you just need to continue practicing that so it becomes natural for you. Okay? If you cough or sneeze into any tissue, you make sure that it is disposed of properly, because there are certain basic things that one can do to control this virus. And lastly, again, just remember, as I said before, this is a war. And I remember going to a graduation ceremony several years ago and hearing the speaker said that there are roughly equal number of responsible and irresponsible persons in this world, and what you do can tip the balance. Okay? And so,
is it a war or is it a battle? Because the war is short term, the battle is longer. And so therefore, it seems as though we are going to be in this for quite a while. I hear that on the BBC, the UK, they are saying that, look, It will probably take us about 6 months. They are a first world country. They're a developed country. The US, a developed country, the world economic power. And we see how they are scrabbling. We see how they are scrunting. We see how their medical system is under so much pressure that it's about to break. And all of that sort of a thing. We are a very, very small island developing state.
But I'll tell you what though, we are going to get through this. You know, I've been through medical crises before. I was a young doctor at the height of the AIDS epidemic when one didn't know what virus was causing persons to die. There was no treatment, etc. And everything seemed dismal. There were graphs that I was seeing being drawn, you know, where the world's population was going to decrease significantly. And we got through that. We got through the swine flu, and we're going to get through this. The important thing about this one, though, is that what we need to do to control it is very basic, and it's within the capabilities of all of us, and we all have to play a part. And if we all don't play our part, we might lose this battle against this virus. And so personal responsibility, that's what we're trying to emphasize in this interview.
Because we're all trying to mitigate against the impact, because the impact will be felt for perhaps years down the line. What it is doing to the economy, what it is doing to us socially, what it is even doing to us politically. Because now, sometimes now, people's political fate rests on how they manage this pandemic. Because health is more important than anything else. Dr. Laws.
Okay, in terms of advice, well, one, I want to add that if you are diagnosed with COVID-19 and you have a fever, if you're experiencing a fever or even muscle aches and pain, and you feel compelled to take a pain or anti-fever medication, paracetamol, Panadol is recommended. Try and avoid taking ibuprofen or Brufen or Advil. So that's one bit of advice that I want to leave with the persons who are looking at this. And again, if you are told that you need to be isolated, again, if you are diagnosed and you're in isolation, or if you're a contact and you are told to be in quarantine, please adhere to the conditions and restrict your interactions with others. Hashtag maintain your social distance of 6 feet. Hashtag maintain your social distance of 6 feet.
If you don't maintain your social distance of 6 feet standing up, it might be 6 feet lying down. And that is what people need to understand. Dr. Laws, thank you so much. Our Chief Medical Officer, St. Kitts and Nevis, and Dr. Cameron Wilkinson, Medical Chief of Staff, I got it right this time, at the Joseph Nathaniel France General Hospital. Thank you for all the work that you are doing to help us in this time of the COVID-19 pandemic. It is really appreciated. Thank you.
And thank you for having us. Thank you.